afternoon, evening, everybody. My name is Fashionetta Williams. This is speech 1315, and I'm doing an informative speech on Alzheimer's. What is Alzheimer's? Do anybody know? No? You do? Good. Well, not a lot of y'all raised y'all hands, so I'm going to inform you and kind of give you a little insight on what Alzheimer's is. Alzheimer's is a disease that basically affects the brain. It's a very well-known disease, but the extent, the cause to prevent it is very well unknown. Like, there's basically no cure to the disease. It slows down the brain. Things you need to know about Alzheimer's is what kind of disease it is, what causes it, and around what age you typically may get the disease. So, Alzheimer's is a neurological disease. Neurological means dealing with the brain, and in which the death of the brain cells causes memory loss, cognitive decline, and it is the most common type of dementia. It accounts for 60 to 80% of causes of dementia in the U.S. Alzheimer's happens when a type of plaque called beta amyloid forms in the brain, which causes you to forget things that you normally would know but don't know. So right now I'm going to show y'all a presentation that I came up with to basically show you how the brain looks normal versus how it looks with Alzheimer's. Alzheimer's. This is my visual presentation. So this is a healthy brain not affected by Alzheimer's. It looks normal. That's how everybody's brain looks on a CAT scan versus a donated brain by somebody. And this is what a brain looks like on Alzheimer's. With Alzheimer's and dementia, you can tell the difference. The brain actually shrinks, and then the gaps that's open is what the plaque is inside. And I'm just going to show you a side-by-side comparison. And you can basically see the difference. And it's a real disease. A lot of people go through it, and it's stressful. Just think, how would you feel if you forgot something that just happened 30 seconds ago? Or you don't remember you're married or have children. Like, your kids could be sitting in front of you. You don't even know those are your kids because the disease is eating at your brain, basically. Alzheimer's affects as many families as 5 million were living with Alzheimer's in 2014. Young people get Alzheimer's, but it's very well uncommon. And a lot of people don't know how to cope with it. So they send their family members to facilities like long-term care nursing homes. And that's where we come in at Cooper Train to help deal with those type of people. And when you deal with people with Alzheimer's, there's a lot of stuff that comes in effect. Age is best known risk for Alzheimer's. Researchers believe that genetics plays a role. High blood pressure, cholesterol. If you don't take care of yourself, they believe that they can develop it, causes changes in the brain that begin to happen years before the first sign of Alzheimer's. Like, you won't notice it. If you get Alzheimer's, you won't notice you have Alzheimer's, but your family member might notice that you have it before you even realize something is going on. Alzheimer's is the 6th leading cause of death in the U.S. A person living with Alzheimer's sometimes can live up to 4 to 8 years before passing away, but most people live up to 20 years depending on how well you manage and take care of it. It's a treatment for it, but there's no cure. And the treatment doesn't cure the Alzheimer's. So, in conclusion, some of the things, most common symptoms. So, in conclusion to this, basically I told you what is Alzheimer's, how it affects the brain, some of the symptoms of it, which is memory loss, you not knowing what happened 5 to 10 seconds ago. It's a very, 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 let me see how would you say it. Heart-wrenching, maybe so, but it's a bad disease that you don't want to get, because who wants to forget their family? So I want to thank everybody everybody for coming